Easy is not going to get you what you want. You have to face struggle. You have to lean into it, and you have to recognize one step at a time. You will get to the place you want to go, and it is worth the pain.
Welcome to Get Unstuck and On Target, the weekly podcast that offers senior leaders insights and strategies to not only lead with confidence and vision, but also to achieve groundbreaking results. I'm your host, Mike O'Neill. I coach top-level executives on the power of ethical leadership to forge teams to be as united as they are effective. In each episode, join me for insightful conversations with leaders just like you, providing practical advice to help you get unstuck and propel you and your company forward. Let's get started. Joining me is Dr. Suzannah Bozzone. Dr. Bozzone is a board-certified family and lifestyle medicine physician and the founder of True Health Journey. She stresses that regardless of the desired outcome, evidence shows that health is primarily dictated by lifestyle choices. She's a true partner to her patients, meeting them wherever they are and offering individualized, evidence-based tools that center around nutrition, sleep, exercise, stress management, and toxin avoidance. Dr. Bozzone has brought this transformational work into many workplaces across the United States. And it was in that role that I was introduced to Dr. Bozzone, and I just had to approach her right after she spoke and said, "Would you come on the podcast?" You said yes. Welcome, doctor.
All right. Well, thank you so much. I'm so honored to be here. This is so fun.
You know, your title, Family and Lifestyle Medicine Physician, that is a mouthful. But for those who are
Right.
not, tell me what that really means. Family and Lifestyle Medicine Physician, please.
Yes, absolutely. So I'm board certified family physician, which most people are familiar with, and most people might not be familiar with lifestyle medicine. And it's one of the most rapidly growing fields of medicine. It's really the evidence-based use of lifestyle. That is, what does the evidence say on how we can use our lifestyle to prevent, treat, and even reverse chronic diseases? And of course, that's why that's so important in this day and age, is because chronic diseases are driving 90% of healthcare dollars. That's our healthcare dollars, $4.5 trillion annually, and it's predominantly driven by chronic conditions. And so when we have really clear evidence that these chronic conditions are founded in what we do with our feet, our forks, and our fingers, according to an article published in 1993 in Journal American Medical Associations, that's really what it shows, is that while we know the primary cause of death is chronic diseases, heart disease number one, cancer number two, diabetes, chronic lung disease, all of these things, we know that the reason we're getting these conditions is geared towards the way we live. And it's those things. What are we eating? How are we moving? How are we sleeping? How we can stress less, love more, connect more, and recognize that we approach this with evidence, but also not with blame, but rather with power, and that's really where the workplace has so much potential, because we can be a community. We can create a community that nudges healthy decisions, that rewards them, that reinforces them, knowing that our built environment has so much to do with the choices that we make. It's not just us. It's if we're fighting against the machine that's saying, all I have to eat is processed food, or it's not safe to walk in my neighborhood, or I don't have the opportunity to move at my lunch break, or things like that. We have this great opportunity in the workplace to cultivate an environment that can nudge people toward healthy decisions and address what is truly driving our healthcare cost and the drivers. There's the same things that drive mental health concerns and physical health concerns. So that's kind of in a nutshell, lifestyle medicine, and how it can be employed not just with individual patients, but I think even more effectively in communities and workplaces.
What drew me particularly to you was not only because you're a great speaker, but you kind of punctuated the importance of employers and how they can have such a positive influence. As you know, I spent many years in HR leadership roles, and one of the things that you're tasked with is to try to design benefit plans that meet the needs of the employees and their families. And it felt very paternalistic, but at the same time, if the employees and their families don't take charge of their own health, no matter how good the benefit might be, it's not making a difference. And you've used the term evidence-based several times already. What does that mean to you? I think I know what that means, but evidence-based means what?
Yeah, that it's throughout, we have layers of evidence. So we've got observational evidence, and that's something, and that's often where our research starts. Who lives the longest? Why do they live the longest? How do they live? What do they eat? That would be the equivalent of kind of the blue zones. We have the longest hot spot, the highest hot spots of longevity, people living to more than 100 years old. But that's observation, right? So how does that apply to me? So then we look at kind of other layers of evidence. We do trials. We look at cohorts and look, over time, if they say that they eat these things or do these things, what happens? And then we do randomized controlled trials. If I do an intervention and compare to a group I'm not doing an intervention, then what happens? And then I look at meta-analyses, and I look at, if I look at all of those interventions and bucket them together, what does the overwhelming evidence suggest based on what we do? So we look at these layers of evidence, and we look at them clinically, and we've been doing that for a long time in medicine. But it's really important to figure out how to adapt the information that we give about lifestyle, because it doesn't come in a pill. And in fact, of course, we know there's placebos that come in a pill that still make change. And so trying to figure out and wade through the evidence of lifestyle and how it can either create an environment that feeds disease or fights it becomes a little bit nuanced, and how we can apply that information that we have into other communities that we build, whether it be working with the city of Chattanooga, or whether it be working with an employer and creating the built environment based on the best evidence that we've seen on many layers of those different kind of trials, to say, yeah, there's a really good amount of evidence that this should work to address what's driving the problem that we see. I hope that makes sense.
Well, I think it makes sense, because I'm about to ask you a question that may be unfair. But when I rattled off lifestyle, nutrition, sleep, exercise, stress management, and toxin avoidance, if you had to pick one of those 5 that I just mentioned that has the most profound effect on our well-being, be it physical or mental, what might it be?
This is a good question, because it's never just one thing. And I think that's what we really learn. I'd say, and one thing that I think is not mentioned there is that we have all of those components, but I think really one of the most important things is that they're on a foundation of purpose. And sometimes we miss that point. Why do we do what we do? And that when I see patients, for example, I'll see them and I'll say, why are you here? And they'll say, well, my blood pressure's high, or whatever they were told based on whatever diagnosis they've been given. And I say, no, why are you here? Why do you get up in the morning? What gives you passion? What gives you purpose? And that is really what I think is the most important thing. And then what I do with them is to kind of redirect the focus almost away from health as the primary endpoint, knowing that, on your last day on this planet, you're not going to say, God, I just wish my blood pressure had been less than 120/80. No one's going to care. What you're going to say is, I wish I had spent more time doing what I am on this planet to do, living the life that I'm supposed to live with the people that I love, and doing the things that are meaningful. And if I can put that in the forefront and know that I need my health to do it, and know that my health is predominantly based on our best evidence driven, 80% or more by the life that we lead, and that what I do with you is based on what you're ready to do. And so while all of those things are important, and I would say if we looked at the standard American way of life, where we have the most opportunity to grow and fight disease, where we are the most distant from what we are currently doing, it's probably through nutrition. But again, is that the biggest, most important thing for everyone? No, because it depends on what you're ready to do. If you're really like, I want to start an exercise plan, and I'm saying, you got to eat kale, then I'm wasting my time and yours. And so it's really about readiness, and it's about laying that foundation, and to know that if I'm listening to you, if you feel heard, if your employees feel heard, then that's really where that growth can happen. And then it becomes a layered approach. And then the step that I do, that I heard, okay, I have a partner in this exercise plan because that's what I'm ready to do, then I start thinking, oh, now I am ready. I'm ready to work on my, I'm sleeping better. And then now I'm ready to work on my nutrition, and it layers on each other if I'm listening to you. And I think it's really driven by the behaviors that we do in the day, recognizing if they are leading us closer to our purpose or if they're getting us further away. And that's kind of, it involves this curiosity. It involves connecting to purpose. And then it involves recognizing that while I might have seen donuts as a reward in my 3-year-old brain, I recognize that it's not getting me closer to my finest self to do what I'm here to do. And therefore, it's not a reward. And so if I'm connected to purpose, then the behaviors that I choose become easier and more sustainable, because I see that as I build behaviors that give me more energy and more vitality, that I'm more able to do what matters most. And then it's a positive feedback loop.
In my coaching work, what I find is oftentimes it's the behaviors, sometimes the behaviors that we don't even know that we're even evidencing that can have the most profound impact. Let me say back to you, see if I understood this correctly. And that is, I know that you take a kind of a holistic approach and you ask a very fundamental question. Why are you here? Not what was the presenting problem. Mm-hmm. Why are you here? And you said something really caught my attention. And that is, what will change behavior is what they choose to change. Yeah. And though you might think that the most important thing might be something different, if they chose something that moves them in that direction, it starts a process. And you use the word layer on top of, but you got to start somewhere and let the patient understand it. We have been talking primarily around physical health, and I'd love to just let's address mental health and how it factors into your work. Can you speak to that? Mental health versus physical health, they're not separate, they're intertwined. Mm-hmm. What are your observations there?
Yeah, absolutely. Well, so as you know, we talked a lot, and we always talk about know your numbers and chronic disease, and that chronic diseases affects 1 in every 6 Americans. But did you know that mental health concerns are more common than heart disease, than cancer? They affect 1 in 5 Americans. And this is really where, some of our biggest crises reside. So this is where I start. And I really encourage employers to include mental health as a big piece of this. And then the recognition that we're not cut our head from our body. And in fact, we know that if we have a chronic disease, we're more likely to have a mental health concern. If we have a mental health concern, or even if we endorse loneliness, we're more likely to have a chronic condition. So they're so tied. They are integrally tied. And if we especially want to recognize that our goal is managing through lifestyle, we have to look at why we do what we do. And that really starts here. It starts with purpose. It starts with motivation. It starts with mental health. It starts with sleep and those things. And if we don't look at that piece, then we're doing a disservice, because these are hand in hand. And we know that a lot of the same drivers of chronic conditions like inflammation will also drive mental health concerns like anxiety and depression. So the sooner that we can put this together and apply in a holistic approach, and really have patients feel connected and supported both with their mental and their physical health, the other one will follow, whichever one their readiness door is. And so yes, absolutely pivotal to address them both, and certainly to have that recognition. If we're in the workplace, to look at, well, how are we managing stress? Right? Because it's not like, so as a physician, I'm going to say, oh, you're smoking. Well, if I just quit smoking, am I going to do anything? Right? Because there's not one person that's smoking that thinks this is on my journey to my best self, right? They're doing it because they're stressed and they don't have any other means to cope with that, or they're lonely, or they're addicted, and they haven't really been felt supported in the tools necessary to combat that addiction. And so it really is important to see that holistically and to manage it as such.
We're having this conversation in the context of employers. Many of our listeners are in key leadership roles within their organizations. And as such, they are participating in decisions. What advice do you have for leaders of organizations to help demystify mental health and put it on a more even keel with physical health? What is it we need to do to address that?
Yeah, well, I mean, I think there's a lot of ways to look at that. We have to destigmatize it, and I think that most people have, or that I see, companies have made big leaps in that recently. I don't know if you would agree with that, but where people are more free to talk about that and to and not so terrified. I've worked with a number of law firms, and coming from a medical background, especially people that are very high up, and I'm sure the people that you work with in C-suites, et cetera, it's scary because you think, oh my gosh, well, I have a license at stake. What if someone knows I'm going to a therapist? Or, I think that there's a lot of that still kind of is there and present, and really does a disservice, particularly for those people that wait often too long. And then we get really kind of very severe before we actually ask for help. And I think that is less of a problem than it used to be, still somewhat of a problem. So number one, destigmatizing it and recognizing that there is support there. There's mental health support, et cetera. But also it's important that they have the opportunity to be heard. And so how do I work with a lot of the HR teams and kind of partner along with to say, and they'll say, okay, well, we want you to come in and do this. And it might be a talk on, say, blood pressure or heart disease or something. And I try to, and while that's fantastic, and I always kind of correlate, well, how does this relate to our mental health and our motivation as much as possible, and empowering the participants to recognize what they can employ in their life. When we talk about what to do or what to look at when we create a wellness plan, I think it's really important to ask your employees and listen. If we see that their primary diagnosis is diabetes, but then we ask them, what do they want more of? And they say stress management. Well, we need to address stress management, right? Because if we're not addressing stress or the stress that's there and their coping skills, then what are we going to do? We're more likely to emotionally eat, right? We're less likely to do healthy behaviors. And those behaviors are what's causing 93% of type 2 diabetes. It's feet, forks, and fingers, 93%. Right. And so that's and you think of the expense of diabetes. And so we can't just see it as diabetes. And so I often try to shift the presentation rather than say, why don't we not call this a talk on diabetes, but rather, depending on what they say, call it something that applies to everyone based on their readiness. Stress management, anxiety is probably one of the top. Mental health, anxiety, and stress are the probably top webinars or educational things that I get asked for more than anything. But in that, if I approach it as that, and then recognize, the food that we eat, if we're eating foods that's going to crash us down, we're more likely to have anxiety. We're not going to be as resilient. We're going to crash. We're going to feel more overwhelmed. If we're not sleeping, we're more likely when we don't have our cognitive capacity about us, but we tend to be more anxious, right? We tend to then drink more coffee, and yet we're being less productive, and so looking at that, and if we can do it through the lens of them feeling heard, it works better, and you get, I think, a better endpoint, and you can still get some of that information that might address your top diagnoses in an evidence-based way, but through a door that is approachable and often better received.
That's excellent guidance. And that is, the numbers might say we've got a diabetes problem. But if you ask the employees, what do you really want to learn more about? They may suggest something that could be the root cause of lifestyle-induced diabetes. I introduced this segment as the purpose-driven workplace, but we really haven't talked about that notion of purpose-driven. When you use that term and you work with employers, how do you want them to at least embrace this idea?
Yeah. Well, I think it's really important to know that, number one, if you look at purpose, we know that people that know why they get up in the morning, they have better life. They have more vitality. They are more happy. They're more resilient, and they have less chronic disease. So connecting to that and creating a culture in your workspace that connects to not to patients, I say that, but to employees that feel heard and that feel that they have the capacity to live to their fullest self and feel connected to their passions. And I think that sometimes we tend, for the sake of productivity, to remove all joy and to remove all of these things that make life worth living. And to know that if we have employees that are happy and connected and healthier, we're going to have better employees. They're going to bring creativity. They're going to bring motivation. They're going to bring positivity to the workplace. And it's going to make it so that we want to be there, because we know that one of the most important things really for health and vitality at the workplace is having a friend there to feel connected. We have like the number one cause of stress in the workplace is feeling a workload imbalance. The number two is interpersonal skills. And we know that we tend to be more resilient and more able to do our jobs well and more productively if we look at those needs and we make the workplace fun and not miserable. So driving, connecting to people's passions and interests where they feel that they can be their authentic, true self, and they don't feel like this is taking time away from their true passions, but rather you can begin to intermingle them. You're going to see a better and healthier and more vibrant, vital workplace in the long run.
You've introduced several things that marry very nicely with engagement surveys. Gallup has shown time and time again, what are the things that are most critical? And you've mentioned three of those right off the bat. Do they feel that they are doing something that uses their talents and abilities? Mm-hmm. You mentioned, do they have a friend at work, a colleague that they feel a sense of connection? And the last one is, do they feel they've been heard?
Yeah.
If you can marry those, then you're listening, you're responding. You have had a fascinating career thus far. Can you share, as you reflect back on maybe a situation where either you or maybe even a patient got stuck? And what did it take to get unstuck?
Yeah, well, I think it might, while I can think of a lot of patients, I might take this to my own experience, because it was one where I was really stuck in my workplace, right? Being a physician, being trained to work in this clinical setting, and then recognizing that my role and what I wanted my role to be was to empower patients to know the root drivers of what's ailing them and to empower them to redirect their health destiny. And what I felt that I was doing in the workplace, seeing 20 patients a day, but seeing them for 7 to 12 minutes and not having time or the capacity or the support to really address the root drivers. So they'd come in with acid reflux. And of course, it's an easy slam dunk thing to do, to just give them a medicine for acid reflux and not talk about what they're eating, when they're eating it, what their stress is like. Are they sleeping? How can we regulate their gut to recognize that, what? There's a reason your body's trying to tell you this. Don't just cover up the symptoms. Let's address the root drivers. And so I felt that I was working in this workplace and it was going against what I would want as a patient and also what I wanted to deliver in my health practice. And it's reinforced, because the sicker the patient, the more the reimbursement. And so until we kind of addressed that, I felt disingenuous. I couldn't be my authentic self. And so, what I was doing was spending 45 minutes with each patient. They would wait because they were coming for that reason, but I wasn't getting lunch. I was doing myself then. All right. I didn't get to, again, I couldn't go to the bathroom. I wasn't coming home to see my kids. And then when I did come home, I'd have to write all my charts because I was trying to fix this problem, and it was just doing me in, and it was losing my love for what the reason I went to medicine in the first place. And so to get unstuck, I really had to number one, recognize that I had to change this. I had to do something very scary and get out of the medical system and say, I need to do something that is authentic to myself. And as a result, it worked out, and I've never been happier. Now, I went a whole year without a paycheck, right? Mm-hmm. So that was not easy, but I wouldn't trade it for the world. I wouldn't trade, having benefits and the regularity of a paycheck and those good things that come with a situation that was driving me into bad health. I was so stressed. I was miserable. I was not the person I wanted to be. I was not the parent or the doctor I wanted to be. And so it really took getting unstuck was to take a jump to do something that was following my purpose and to really align what that was and to know that it's not easy, but being easy is not going to get you what you want. You have to face struggle. You have to lean into it, and you have to recognize one step at a time. You will get to the place you want to go, and it is worth the pain. Vale la pena. It absolutely is worth when you're connected to purpose. You know what your true reward is, and don't expect it to be without struggle. But I think it just takes creating a support around that towards the person that you're striving to become and not losing sight of that.
Yeah, you just used a phrase. It was that I didn't recognize. Was it a different? Was it Spanish or was that or was it Italian?
Spanish. It was Spanish. Vale la pena. It's worth the pain. Basically, it's worth the struggle because in the long run, what you are going towards is again, it's not towards getting the blood pressure under a certain number. It's not towards just having an MD behind your name. It's towards putting all of your past struggles and past experiences, good or bad, to recognize that they will strengthen you towards the person that you're striving to become, to do what you're on this planet to do. And it's not going to be easy, but it absolutely is worth the struggle to get there, because when it's all said and done, then it becomes, rather than why I can't do this, it's why wouldn't I do this? Whether that's about exercising. Of course, there's plenty of reasons why I don't have the time or the energy. There's a lot of other stuff I want to do. Well, but how could I not do that when I know how important it is for my vitality, for my energy, for my sleep, and to do the things that I have to do on this planet, or whatever it is that you're looking to do, whether it's your food or your sleep or your whatever. It's not why I can't, it's why wouldn't I? And you know that because you're so connected to what the end point is of that behavior you choose. And then it becomes something that's not work, but rather fun and is natural, and it's creating behaviors towards that bigger end.
Yeah, as you reflect on this conversation we've had thus far, and you say, gosh, there's a few things I definitely want the viewers and listeners to have as their takeaways. What might they be?
Well, I think it's just that. I think it's really connect to what your purpose is, that every person out there does it and does it regularly, because it's not the same as it was 5 years ago or 10 years ago, or certainly, from a personal perspective, it's not the same as it was when I was in medical school. I just was trying to get to the next, I want to be a doctor. Okay. But I think a lot of people in the workplace, we get there and then sometimes we become a little stagnant. And that's where some of these habits that become default habits kind of arise. So connecting to purpose wherever you are, and then asking yourself where there is opportunity, not where there's obstacles. So looking at the habits, not with criticism, but with curiosity. And I say this kind of, as in I would with a patient with one-on-one, but recognize that if we're doing it for ourselves, then we're more likely to do it for our workplaces. So if you're in a workplace, you want your other workplace, you got it. They got to get some of what you got, and then it becomes contagious, and then you can create communities. And that is what a workplace is. You can create communities where the healthy option is the easy, natural, and better yet, fun and engaging option. And then imagine what we could do to redirect our health crisis in this country if workplaces were on board with that. The change that we could make is unstoppable, right? People have to spend a third of their life at work. Well, what if they wanted to spend a third of their life at work? And what if they were becoming healthier and more vibrant and more connected in that time? And then look at what we can do to these averages, to these unfortunate health stats that we find. And it's just, there's so much opportunity. And I hope that what they take home from this is that there's opportunity wherever you are to be your best self. And that makes other people want to be theirs. And if that's what they can take home, we can change the health crisis that we are in.
Most podcast listeners do just that. They listen. People may or may not realize we're recording this both audio and video, and I get a chance to watch your eyes light up as you're talking about that. This has been a lot of fun. But before we wrap up with our final thoughts, I've got a question for our listeners. And that is, are people following you because they have to or because they want to? Are they obligated or inspired? I'm a leadership coach, and I work with executives who have a successful track record, but are now feeling stuck in their careers or how to move their company forward. They're frustrated because they're finding that with each level of success, the bar gets set even higher. But what worked in the past is no longer working. I work with these leaders to uncover those hidden blind spots, challenge those limiting beliefs, and foster a strong sense of accountability. So if feeling stuck sounds like you or someone you know, let's talk. Head over to bench-builders.com to schedule a call. Dr. Bozzone, I loved this conversation. I was looking forward to having that. You really have opened up my eyes to a number of things that I haven't thought about. Thank you for sharing your expertise.
Thank you. This has been so fun. I really appreciate your time and what you're doing. I think it's fantastic.
If folks want to reach out to you, what's the best way for them to connect with you?
Yeah. So if they want for employee health, my website is mytruehealthjourney.com, and then go under services and it's employee wellness under there. So that's the best way. If as a patient, if you're here in the Chattanooga area, then you can see me through there. I also work for Love Life Telehealth, which I cover 7 states in Love Life Telehealth. And there's a bunch of lifestyle medicine providers there. It's the most amazing team of physicians that I get to work with through telehealth. And I'll also have a YouTube channel, Dr. Suz B, DrSuzB. And I do a lot of just quick things there that give about 5-minute videos and tips on how to employ lifestyle medicine in your life.
I'm going to do something I don't normally do, but your name is Suzannah Bozzone. Let me spell that for our listeners. Suzzannah. Bozzone is Bozzone. And so I imagine people would reach out to you on LinkedIn as well.
Oh, yes. LinkedIn, and I'm on Instagram and Facebook, though I'm not incredibly great at those.
Well, I'm not either.
I am.
LinkedIn is probably my preferred. And you mentioned Chattanooga. For those who are listening, kind of go, where is Chattanooga? It's in the state of Tennessee in the United States. And we have listeners from all over the world. So with telehealth, they could tap into your enthusiasm. Again, thank you for spending some time with us today.
Absolutely. Thank you so much. I so appreciate it. I hope we will stay in touch.
I want to thank our subscribers for joining us, and I hope you have picked up on some quick wins from Dr. Bozzone. They'll help you get unstuck and on target. Thank you for joining us for this episode of Get Unstuck and On Target. I hope you've gained insights to help you lead with confidence and drive your organization forward. Remember, at Bench Builders, we're committed to your success, your leadership excellence, and your strategic growth. If you've enjoyed our conversation today, please leave a review, rate, and subscribe to keep up with our latest episodes. This show really grows when listeners like you share it with others. Who do you know who needs to hear what we talked about today? Until next time, I encourage you to stay focused on the target and continue to break new ground on your leadership path.